Hi, I'm Dr. David Hill, and today we're going to talk about treating intestinal parasites in toddlers. Now, intestinal parasites are relatively common in children. Why? They like to play in dirt, and they like to put their hands in their mouth, and they like to put dirt in their mouth, and that's a great way to get an intestinal parasite. They also love petting animals. They might even like playing in the cat box a little bit, and they're not always good about washing their hands before they eat. So, kids tend to get intestinal parasites. The good news is that intestinal parasites are rarely life-threatening. Diagnosing intestinal parasites may be very easy. In the case of pinworms, you might look at your child's bottom in the middle of the night and actually see the little white worms crawling on the bottom. Likewise, for some of the larger worms, you might actually see the worms in the stool. That's a great way to know your child has intestinal parasites. For children with subtler symptoms, loss of appetite, unexplained abdominal pain, there may need to be some lab tests. Your doctor may order an ova and parasite exam that looks both for the parasites themselves and for their eggs. Sometimes you need 2 or 3 stool samples to find the ova or the parasites. They're not always obvious on the first look. Once you've diagnosed parasites, treatment aims at hitting the parasite usually at 2 points in the life cycle. Most of the treatments we use for intestinal parasites don't kill them in the egg stage, so we almost always either treat for a total of 2 weeks, or we give one treatment, wait 2 weeks, and give a treatment again. Now, depending on the parasite, the regimen may vary. Sometimes the regimen's only 1 week long. In many parasites, we assume that if one member of the family has it, everybody has it. So it's not that uncommon that if we're going to give your child a medicine, we're probably going to prescribe it for every other member of the family. Once everybody's been treated, the parasites really should be gone unless there's some source of reinfection. Talking about how to treat intestinal parasites in toddlers, I'm Dr. David Hill.